So part one, left hemisphere syndrome. So imagine if a patient comes to you and you find that he has or she has a left-sided stroke. Many questions arise. What should you do? What should you expect? What should you look for? And so first, I want to talk about the various symptoms that can happen after a left hemispheric stroke. First, from a physical perspective, you might experience right side motor weakness. You might have right sensory loss. Notice that the patient might have even a right visual field defect. Perhaps they might have apraxia, where they have difficulty with motor planning and motor movements. From a cognitive perspective, you might notice that they have difficulty with verbal memory and learning. And a fair number of folks who have left-sided strokes also have language difficulties. These are characterized by problems with expression, being able to say what they want to say, or being able to name objects. Conversely, they might have difficulty understanding what you're saying, comprehending what's going on. That is known as receptive aphasia. Lastly, it's common for folks who have left-sided syndrome, left-sided stroke, to also have difficulty with their academic skills. You might notice some reduction in their ability to read or write or even solve math problems. In general, as a whole, individuals with left-sided stroke tend to be very aware of their symptoms and deficits. Consequently, they are very concerned and are more prone to experience depression or even adjustment-related disorders. I want to take some time to talk about the posterior left hemisphere lesions, because this is linked to a number of common problems. First, you might find that these patients may exhibit agnosia. So just difficulty recognizing signals. They may also exhibit apraxia. So this is a problem with motor planning. For example, if you ask them to pretend to use a comb, they might not be able to carry out that motor command. Similarly, they may experience alexia, a problem with reading or understanding written language, agraphia, problems with writing, acalculia, problems with math skills and solving problems. And lastly, a really small percentage of patients with left-sided strokes may exhibit Gerstmann syndrome, which is where they have difficulty with deferring the left to the right, so problems with left-right orientation. They also show bilateral finger agnosia, acalculia, as well as agraphia. Now I want us to focus on emotions and have us think about the left hemispheric functions as it relates to emotions. With the left hemisphere, it's the part of the brain that helps us to recognize positive emotions more easily. So to be able to detect when someone's happy, joyful, at peace. So when you think about a patient who has a left-sided stroke, they might have difficulty recognizing these positive emotions. As a result, you may find that your patient might have less spontaneous talking. They may be a little bit more aware of what's going on, and as a result, just be really concerned about their deficits. And as I alluded to earlier, they are more prone to experiencing post-stroke depression. especially with regards to strokes in the left frontal region. So now that we have an idea of the various deficits and syndromes associated with left-sided strokes, I want to share with you general treatment strategies that have helped me work with patients who exhibit these symptoms. The first thing to think about is to be able to modify your environment to enhance patient care. As much as possible, minimize distractions in your environment. I often find it best to meet my patients in a quiet, private room where there are minimal distractions. While I'm working with patients, I'm very aware of both verbal and nonverbal communication. Some of these patients have aphasia, where they have language difficulties, either in expressing their thoughts or understanding what you're saying. So I try to look at all areas of communication in order to enhance that patient-physician, patient-provider interaction. Next, I ensure that I maintain good eye contact with them. Primarily because, again, individuals with left-sided strokes may have attention difficulties. They might have problems following what you're saying. And so having good eye contact ensures that you have their full attention. Next, as much as possible, I try to simplify the information that I give to them. I keep all information very brief, short, and concise. And I give my patients time to think and respond to what I have to say. If I'm unsure that they don't understand what I'm saying, I ask for clarifying questions, and I want to make sure that they fully understand what I say. Some additional considerations to note are those for individuals who have aphasia, language difficulties. It's actually quite common for me to repeat or rephrase the things that I say to them in order to enhance their understanding of the information. Try not to ever talk over him or her. Again, here in stroke rehabilitation, we want to ensure that their voices are heard or that we're meeting them where they're at. With patients who have language difficulties, often I find that it's very helpful to provide multiple choice responses. That way, if they're having difficulty fully expressing their needs or their wants, then when I provide multiple choice responses, they're able to just pick and choose, and that conveys their needs. I incorporate visual aids with my verbal explanations. So often I'll have handouts, or I'll gesture, or I'll give them hands-on experience and demonstrations to enhance their learning or understanding of what I'm trying to say. And lastly, I double check that they understand everything that I review with them. Additionally, at times, I will also adapt to their cognitive level. Individuals with left-sided strokes tend to have difficulty with organization. And if you think about it, if they additionally have communication difficulties, it's hard for them to follow. And so in my work with them, I often just work on one task at a time in a consistent and structured way. This approach best helps them to learn the information that you share, and it helps them to track information as well. I always try to informally assess for their level of awareness or insight into their deficits. I want to get a sense of how good of an understanding they have about their current symptoms, because this factor contributes to their overall outcome and recovery process. If I notice that they're getting tired or that they're tuning out or falling asleep, I'll also limit the time that I spend with them and give them rest breaks as needed. Lastly, it's very common for patients with left-sided strokes to be confused or to even forget what you just said not too long ago. With these patients, I often give them the accurate information or correct their understanding of information. Thank you